1 minute you're swinging a golf club or picking up your kids, and the next thing you know, your back is out. You're in excruciating pain, begging for relief.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
Hello, everyone. I'm Willard Shepard, your host for today, and it's important for men not to hit the snooze button when it comes to their health. Instead, take a proactive approach to staying on top of it. Now, to talk about the top threats to men's health, we are joined by Dr. Alexander Toirac, cardiologist at Baptist Health Miami Cardiac Vascular Institute, and Dr. Richard Morgan, spine care physician at Baptist Health Miami Neuroscience Institute. Before we dive into today's subject, I want to remind our viewers to send in your questions and comments. And in the comments throughout this discussion, we're here for you and happy to answer any questions you may have. So let's start out with some of the top research questions in the internet in terms of regarding men's health. First thing we want to take a look at is we're talking about heredity. So in terms of that, for both of you, how would my father's and my grandfather's genetics that are passed on to me have an impact? Let's start with the cardiac health first.
Yeah, sure. So, it's very important. There's genetic predispositions. There's, factors that, make you higher risk, particularly if your family history, had something like heart attack, strokes at an early age. So we take into account, it's not to say if your father had a heart attack, I'm going to have a heart attack, or you'll have a heart attack, but it's definitely important to know that history because maybe we should be treating you more aggressively for prevention than somebody who doesn't have that history.
What about the spine and genetics? Does it play the same type of role?
It does play a role. There hasn't been any good research indicating what specific genetics play a role. Everybody's spine undergoes changes, not only through playing sports, not only from being very active, but just from being here on Earth and being under gravity for so long. Our spines do undergo many different changes. So there are genetic predispositions, but they haven't really been identified yet in the research.
Okay. In terms of diet, and this is something that we have talked about earlier. I talked to you about, I'm very diligent about my diet, the amount of carbohydrates I take in, those types of things. What kind of impact can a diet have when it comes to your cardiovascular health?
Yeah. Huge impact. Us in cardiology, we've always, put up the Mediterranean diet, the DASH diet. You've heard of those two things for treating heart disease and, hypertension. So we know diet plays an important role. It's not the only thing. Obviously, we'll talk about it a little bit in a little bit about exercise, but diet is something that we can all control and something we know plays an important role in many aspects of cardiology.
I would imagine when it comes to the spine, a diet's associated with weight, and
Yes.
weight would then put more stress on the spine.
Exactly. So we also recommend the Mediterranean diet. And yes, weight can put more stress on the spine. It can accelerate some of these changes that I previously mentioned in the spine. So we recommend following the Mediterranean diet, staying active, particularly swimming, aerobic activities to help keep that weight off. So it's a combination of diet and exercise that's really important.
Talk about the stretching and the importance of that when it comes to keeping your spine healthy and flexibility.
Flexibility is really important. Mostly flexibility of the glute muscles, the hamstrings, maintaining that mobility in the legs and in the lower back, but also strengthening the core muscles, strengthening those back extensor muscles. Those muscles help stabilize the spine, help slow down the changes that occur in the spine with time. So it's more of the strengthening exercises than the stretching and the flexibility aspect of it.
What about when it comes to our heart and saying, I'm in pretty good shape, but there could be something else going on?
Yeah, the spiel I will give my patients is, there's a few things we can control. High blood pressure, diabetes, exercise, diet, those, and tobacco use, obviously. You can control those things. There's some stuff out of our control, genetic factors, things like that. So just because you're very physically fit does not always mean you're healthy from a cardiovascular standpoint. You're a perfect example of that. So, but you're halfway there for sure. So I think it's important, especially once you get to a certain age where you have to start checking yourself for these risk factors, for these numbers to see how we can optimize our cardiovascular health.
I always say I have a duty to make sure that I let as many people know about what happened concerning me and how it can happen to anyone. And that, I was relaying to you that, my military flying, being an athlete, being a competitive boxer, even still at my age, and detecting through seeing the cardiologist as part of my regular annual FAA flying physical, detecting something that was going on. And even though my heart was in great shape, I ended up having a triple bypass. But that is something that I recovered from instantaneously. So talk about that, where a person can be someone like me, but still have that kind of underlying issue. And that's why it's important to always investigate.
Yeah, I think this is where history becomes very important. You yourself, while very active, boxed, you're very physically fit. You had a big risk factor. Your family history was very strong for heart disease.
So my grandfather,
yeah,
who was a physician, died at 42 in his office from a heart attack.
So that's incredibly important, because if I knew that about you, otherwise, if I just knew how healthy you were and active without cardiac limitations, I wouldn't think about it too much. But knowing your history, I would definitely investigate much further than somebody who didn't have that kind of history.
When it comes to the spine, I've been in the gym, and I'm sure you have, training and working out, and you're, oh boy, that wasn't good. Mm-hmm. I'm told that it's pretty easy to herniate a disc and those types of things, and that many discs are not far from having a herniation. Can you go over with us and talk about what, if anything, we can do to prevent that?
Yes. So with time, our spine undergoes many different changes, and that predisposes us to those disc herniations, as you mentioned. And it can just take a sudden movement to go pick up a pencil off the ground that can trigger that disc herniation. So really stabilizing those core muscles, strengthening those core muscles, and also just being aware of some of the movements that can trigger a disc herniation, such as a sudden movement, bending forward, down, and picking up that object very rapidly. That can trigger that disc herniation. It's always better to bend the knees and bend at the waist. When you're going down, go directly down, pick it up, and then go straight back up. So these are some of the movements that we go over with our patients. Also, we go over some of the activities that we recommend that the patient undergo or stay away from, and that can help prevent those disc herniations or major causes of back pain, as you mentioned.
Can you go over that? Just what should a person do or not do, the types of things they shouldn't be participating in, because once you have that happen, it's a difficult time for most people.
Yes. And so if it really depends on what is causing the low back pain. So that's a tricky question, because it depends on what's going on in the spine. A disc herniation, typically we want to recommend against that rapid forward bending at the waist. Now, there are joints in the back of the spine, and we see this in a lot of golfers, where those joints in the back of the spine can have arthritis. They can have some inflammation within the joints, and that can cause pain with the back extension and twisting. And so the activities that we recommend against with patients who have inflammation and arthritis of those joints is going to be different than the activities that we recommend against with a patient who has disc herniation. So,
we're encouraging people to make sure they stay ahead of their health, to go and find out, get good lab work, check all of those numbers, those types of things. Go over those types of goals for us when it comes to cholesterol, blood pressure, some basic data that can tell you kind of where a person is.
Yeah, for sure. First of all, I think there are some age-specific guidelines out there, but in general, I tell people, listen to your body. If you're all concerned, come see somebody. And things we check routinely at every visit, obviously blood pressure, laboratory work, cholesterol levels, markers of diabetes. Obviously, weight is something that's checked every time as well. So those are the big things that are easy to check. They're readily accessible and easily modifiable as well.
Doctor, what's changing the game for people who do have back trouble to try to help them?
So back pain is very common in the community. So there has been a lot of recent research to meet the need of people in the community with back pain. So there's a lot of new non-invasive approaches to low back pain, incorporating aspects of diet, exercise, different types of injections if needed, medications as well. So these are all different modalities that we can incorporate into treating low back pain.
What about a person's posture and just their normal activity throughout the day and how they carry themselves?
Yes. So the posture comes into play too. So a lot of people have their shoulders rolled over, especially if we're on the computer a lot throughout the day. Shoulders rolled over, kind of hunched in the back and bent at the waist. And this puts a lot of strain on the discs within the spine. And so that's something that can predispose us to low back pain, pinched nerves in the back, and other causes of low back pain as well. So these are all different aspects that we address in our clinic, and we make recommendations as to how we can correct that and to improve going forward.
Touch base on that about a person and many people spending 8 hours or beyond at their workstation. I see some people now standing at a workstation and those things. Talk about that time during the course of the day at a person's job when they're spending more and more time at a computer and how important it is to do that properly.
Yes. So we recommend taking breaks, standing up for a little while. If you do have access to a standing desk, that's excellent. We recommend that as well. So we don't want to be seated at the computer for too long because that also puts a lot of strain on our low back. It's not good for our posture, and it can also weaken the abdominal muscles. The abdominal muscles help stabilize the spine, so actually, long term, that can also accelerate the arthritis, the different changes that we have in the spine as well. So there are a lot of different modifications that we can make into our workspace, and so that's something that we have to be wary of, especially since a lot of people are at the computer many hours throughout the day for work and other activities.
Okay. A panic attack, sometimes people think I'm having a heart attack. So go over that and try to give us some tips as to how to differentiate between those.
Not sometimes, a lot of times people think they're having heart attacks. And it's because the symptoms, I mean, they resemble each other a lot. I mean, you can have chest pains, you can have flushing, you can have tachycardia, you can have just this impending sense of doom. So the symptoms can be very similar. And, I think listen to your own body. I think what's helpful is we have testing initially. A lot of times people have been evaluated in the ER, and we have EKGs and stuff that we can tell us already, have a good idea. This is not a heart attack. This is probably, and mental health is a big issue. And I think it's a big thing. So these are real symptoms. You have to acknowledge them. Oftentimes, even in a patient who I may not think has heart disease, this may be related to anxiety or whatnot, I may still do testing on them just because I think peace of mind is very powerful. And I think if I think it'll help them get over this in the future, I will often do it. But it's not easy, okay? These symptoms often resemble each other tremendously, and, you just have to tease out and talk to the patient, and, it's not easy, but there's ways to do it, and usually it involves some kind of testing to rule stuff out.
So what do you advise a person when they're only around lay people and they don't have you with them when they're experiencing something like that at the workplace or with their family? How should they handle it?
Yeah, I mean, the heart's it's scary. So like I said, listen to your own body. If you're at all concerned, do not be afraid to seek medical attention, whether it's calling our office, going to the ER. It's not going to hurt you. It may take some time and, get some blood draws, but I think that's what I'd always recommend patients first and foremost. After the first few times, they now understand kind of what it feels like, and maybe they'll be a little more hesitant to have to think they need to seek attention for it. But if you're at all concerned, seek attention without a doubt.
Surgery can be frightening, but especially for surgery on the back. I think psychologically that's something that people are just naturally frightened of. Walk us through all the things that can be done prior to that, and when would there be a time where that type of decision would need to be made?
Generally, we try to exhaust all different types of conservative management and non-invasive approaches prior to considering surgery, unless there are some red flags or alarm symptoms or exam findings. So some of the different approaches that we could take is physical therapy. Physical therapy with an emphasis on core strengthening of all the pelvic stabilizers, the glute muscles, the hamstrings, the quads, working on flexibility, especially of the low back, the pelvic stabilizers, like I mentioned before, all those muscles around the pelvis, and also aerobic activity. So we encourage aerobic activity for weight loss, also for cardiac health, as mentioned as well. And so those are some of the aspects that some of the different approaches that we could take to conservative management. Now, physical activity can also have positive effects on psychological health, behavioral health as well, on mood. And so that's another positive aspect of physical activity. It could also accelerate tissue repair. If there has been an injury, physical activity can help speed that up a little bit. And it can also help with inflammation. So there are a lot of different benefits to physical activity, not just strengthening the different muscles around the core and the pelvis. So.
Speaking of that, and you're a football player before, though, so tell me about now your thoughts about weight training versus band and strength training and things in another area for the general population. I think many times men think, I got to go to the gym and sling a bunch of weights. Mm-hmm. So talk to me about where you are with that now and what's really best in terms of having the right functional strength.
Yeah, so I think it's important to have to incorporate a combination of each one of those: aerobic activity, resistance band training, as you mentioned, and also strength training with barbells and weights. So it's important to incorporate all aspects into your workout routine. And I think that, especially for the athlete, going one way or the other is actually hindering their potential as an athlete as well. So it's important to take into account all different aspects of the exercises, as you mentioned. And actually, one other thing that I would like to mention as well is technique is very important as well. Mm-hmm. So it's really
always worried about people doing CrossFit with that and, snatch and jerk type power exercises and the risk of that being so high to hurt your back versus the benefit that you're actually going to get from it.
Yeah, technique is essential. So especially we see this with weight training, especially with deadlifts, squats. A lot of our younger men, they like to try to get as strong as possible, as fast as possible, without making sure the technique is flawless. And that's one possible trigger for low back pain as well, if you're throwing too much weight on the barbell and not doing it correctly.
All right.
To piggyback off that, actually, from a cardiovascular standpoint, I think the benefits of, or well documented, what aerobic exercise can do for you, and it's probably even more than we can even recognize so far as data and whatnot. But I think strength training is incredibly important. I see a lot of elderly patients, and we know how much strength training improves frailty later on in life. And I think we're recognizing more and more that obesity is something that now we're treating a lot, is the benefits of strength training, particularly when it comes to weight loss as well. I think people don't always realize that, but there are a lot of data research out there showing that strength training actually is very important for weight loss as well. So I think a combination of both things is ideal.
Well, if we take care of our back and our spine and we take care of our heart, chances are the rest of our body's going to fall in line and we're going to be in great health. So thanks to both of you. We appreciate all of your expertise today, very much so, and the best to you in your practices and helping the patients here. All right, it's been a great conversation. Thank you for sharing this insight with our audience so much. And remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the very latest health and wellness information, tips from our experts. And thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.